All right. Well, I'm excited to hear our speaker for today, Katora Printup. She's Printup. I'm sorry. I've been practicing that where I get it right and I messed it up. I'm apologize. I'm going to read a quick bio. I did. Printup. So this week, our speaker is Katora Printup, the Executive Director of the Northwest Georgia Family Crisis Center. She will be telling us about the work she and her staff are doing to serve those who are affected by domestic violence to get back onto their feet and back to living safer and healthier lives. The Northwest Georgia Family Crisis Center serves all victims of domestic violence. The agency serves Whitfield, Gordon, and Murray County. The mission of the Crisis Center is to end violence in the home by providing shelter, advocacy, and the support to the victims while working in the community to change attitudes, beliefs, and behaviors. Katora graduated from Gordon Central High School in 1993, received a Bachelor of Science degree in 1997, and her Master's of Public Accounting in 2000 from Jacksonville State University. She worked with the Department of Family and Children's Services in Gordon County for 8.5 years before becoming the Assistant Director of Northwest Georgia Family Crisis Center in 2007. 2 years later, she became the center's Executive Director. So we want to give her a warm welcome and hear her speak.
Good afternoon. And as Ricky has stated, I'm Katora Printup, and I am the Executive Director of the Northwest Georgia Family Crisis Center. And we serve all victims of domestic violence, men, women, and children. And people like men, we do serve men. We don't serve as many men as we do women, but we do serve men. And we get the question, men? So yeah, it's hard for a man to stop on side of the road and ask for directions. Let someone pick up the phone and call and say, "Hey, I need help." But but we do serve men, and we've seen some really dangerous situations with men also. But what we do, we serve men at an off-campus location. But as I said, we serve Whitfield County, Gordon County, and Murray County. Our actual shelter is here in Dalton, but we have outreach offices in Gordon County, Murray County, and we actually have an outreach office here in Dalton. Our shelter capacity is 36. And outreach, when we say outreach services, what we mean by outreach services, that is for anybody that does not need shelter. They may be safe in the community with a family member, a neighbor, but they still need our services. And they're able to stay where they're at, but still receive our services. And when I talk about service, we have legal advocacy. We have a legal advocate that's housed at the courthouse in the DA's office. They're able to receive client assistance. And what I mean by client assistance, they're able to, if they find new housing, safe housing in the community, or if they need to relocate, or they just need to start over because they've been controlled and they just haven't had the funds or the means or the resources to be able to get out of this situation. And so what we try to do is we try to help them to gain stability. We empower them. We do not do for them, we empower them. So we try to encourage them and provide the necessary resources so they can make these moves into the community and be able to live safe. We are a United Way agency, and United Way is one of our biggest funders. We also receive funds from state and federal funds, local foundations, just local contributions from the community also. I try to slow down because I go so fast, and then I'm like, oh, okay, that's the end of it. Um, but the way we provide services is we have a 24-hour hotline number. That number is 706-278-5586. So victim would call the number and they would say, hey, I need help. They may say, I need to come in the shelter, or I just need a support group or something. So the caller, we have someone answering that hotline number 24 hours a day, 7 days a week. And they assess the situation, and they're able to either come into shelter or say make an appointment with the advocate on an outreach level. They are escorted into our shelter by law enforcement, and all that is that's for safety. A lot of times when we say that, the victim may get nervous. Law enforcement, we tell them, hey, they're not running your background or anything like that. It's just for safety so that the abuser may not follow them into the shelter. Our location is confidential. We do not give out our location, but I'm sure there's a lot more people in the community that know where we're at than should know. But we work real close with law enforcement, and we're able to call and ask for extra patrol if we think someone may be riding in our cul-de-sac. But law enforcement is really great to work with us and to provide safety. We have a gated facility. We keep our doors locked. Anybody that visit our shelter, they have to sign a confidentiality form, and the children are able to go to school while they're there, but they're always the first ones to get on the bus and the last ones to get off. And that's for safety. So the other children won't say, oh, I know where they're staying at. But so safety is our number one concern. And as far as what we're going through right now with the virus, the pandemic, we've been really busy. When what we're seeing, there was an order for shelter in place or staying home, and that's really difficult for a victim of domestic violence, especially if their home is not safe. They're having to stay in the home with their abuser, or they're just not able to reach out for help. So we've kept our doors open during the entire pandemic. So our hotline, where if someone needs service, they're able to come into service. And also, being sheltered in place is also may not be safe for children also, and that's because they're not able to make the connections that they would make if they didn't have all the we were not dealing with the pandemic. So we have seen an increase in our numbers during this time, and I think because the problems with no money, more problems, and we so any stress can cause more problems or cause more abuse in the home. And sometimes lots of people say, well, they only come into your shelter if they have black eyes or broken bones. No, that's not true. They may be verbally abused, emotional, financial abuse. We serve all, not just physical domestic violence. So anyone that's being abused, either way, physical, financial, emotional, they're able to call us and ask for help. Um, any questions? I like to stop in between before I just keep on. Any questions?
You describe without telling us where it is, the facility that you have there at the shelter.
Yes. It's communal living. Okay, so in there we have two living areas, just if they had a living room at home, so they're able to watch TV, and we keep families together. We have 8 bedrooms and three efficiency type apartments, and those apartments are for families if we have small families, or if we may have teenagers, and sometimes we may have a teenage boy with a mom, and so we try to put them in the apartment to keep them separated from the other females in the shelter. But we keep the families together. There could be a room that has 4 single ladies, or it could be a room where there could be a mom and a child and 2 single ladies. So we try to keep the families together, but we may have to do some moving around in the shelter so that we can keep the families together. If we are at capacity, we contract with a local hotel that we may have to put someone in the hotel. And sometimes we have to relocate victims because of safety. If their abuser may know the location of the shelter, we would work with another shelter. There's 46 certified shelters in the state of Georgia, and we would work with them to relocate them. And sometimes they may relocate and say, hey, I have family, I have support, and I will be safe because they may have to move out of this area. And we have a kitchen. They cook their own meals. We have a nutrition planner there, and they work with her, but we allow them to plan their meals. These are the things that we have, and they're able to come together. And shelter, we provide support groups for the ladies, and that's where they're peer support groups that they're able to talk to one another or hear someone else's story to realize that I'm not the only one going through this. We try to do outings, of course, with the pandemic. We've been a little lax on that, but we do outings with the ladies. And sometimes there are things that they've never been able to do before because they've been controlled. We offer a 1 week summer camp for the children, and these are opportunities that they never had before. Opportunities where they may go to a petting zoo or go to the arcade. So we try to do a therapeutic summer camp for the ladies that the children that's are the victims, that just opportunities that they've never had before.
For more fun. Very good.
Any other questions? And this has also been a different time for us because we have experienced some cuts, and I'm sure everyone would be, oh, I figured that. But, from federal or state funding and some of our local donors, we've experienced cuts in those things. But lots of our fundraisers, we usually have one of our biggest fundraisers is the tour homes, and that is in December. We were not able to have it this past year because of the pandemic, but we had a cute little idea of you're not invited. So we did receive some donations from that. We were able to pull off a golf tournament, but just things have been different going through this past year and with the pandemic. So, we've tried different areas of trying to reach out to do things different so we can continue to bring in those donations. And I know there were some agencies that were just not able to provide services during this time, but we stayed open and provided 100% of our services during this time. With this going on, we try to let all victims know that they're still help and we're still available. And that's one of the things that we try to do in the community, let everyone know that you're not alone. There is help. Lots of people say, I didn't know about you all. Well, it's one of those things. We want to get the word out, but we're just confidential. We try to be confidential for safety, and all our services are free and confidential.
How much of an increase during the pandemic have you seen?
As a percentage, I wouldn't know right off the top of my head, but I know, say, in the last quarter, we have been at capacity, and that may have not been actually in the shelter. We have used the hotel a lot in these the last couple of months, and that is because of if we have anyone that needs quarantine, we would use the hotels to be able to do that so that we wouldn't have this huge outbreak in the shelter. And actually, we've been very fortunate as far as staff or any outbreaks in the shelter. We've been real fortunate about that to where we're sort of getting a jump on it before we have this outbreak.
How's the intake process working with COVID, that sort of thing?
So as everybody, we're doing some more over the phone, but what we're still trying to do is offer the face-to-face, but still social distancing. And if there are any groups, small groups or anything, but social distance, and we're doing masks. And actually all our clients that we've served have been really good in the shelter, keeping everything wiped down and disinfected and everything. But as far as our intake pack, they would still come in. We just we had an office, a small office, but we're in a bigger area now as far as doing the intake process. But it was still the same. But if someone calls us and say they may, have not been feeling well with a fever, what we would do is let them quarantine in a hotel, but we would still provide them services.
How do you, I know you talked a little bit about funding. Are you strictly funding that way? Do you have any type of governmental funds?
Yes, we receive state and federal funds. We receive funding from the Criminal Justice Coordinating Council. We do receive that, and we local foundations and just private donors. But United Way is one of our biggest funders. Any other questions? And one thing that we do like to emphasize is that you do not have to need shelter to come in to receive our services. Like I said, on an outreach level, and actually we may provide more outreach services than we do shelter services, where a client may feel safe in the community if it's with a family member or in their own home, but they're able to get a temporary protective order that would help some with the safety. But you do not have to come into our shelter to receive services. But if you need shelter, we offer shelter.
In your brochure, you talk about teen dating violence.
Yes.
Could you highlight that a little bit more?
Yes, we do offer teen dating violence services. And what we're seeing is an increase in teen dating violence where we're seeing the control issues or even physical in teens. We're in the high schools. Of course, this year has been different, but we try to still reach out and provide them information for the teens. But we're seeing domestic violence start at an early age. And so what we reach out to the teens, there's a national teen hotline, domestic violence hotline number, a teen text line, but we're in the school providing presentations for them. And we try to get them engaged, stay up, they like t-shirts and provide them with a hotline number, or do outreach groups for teens, and we try to offer a support group for teens. But that is because we're seeing a rise in domestic violence starting with the teenagers, and actually with middle school.
I also see that you mentioned cyber and digital abuse, and I'm in the cybersecurity world, so I know that's a big thing. You do educational type things? Or?
Well, actually, what we do is we try to, and I would be reaching out to you if we were not in the pandemic. What we try to do is bring someone like yourself to come in and speak and train our staff, and that. But we do see a lot with the clients of, social media. We have problems with maybe an abuser sending a message or things on social media, and abuse style things that's going on with that. Mm-hmm.
One of the things that I've seen when your staff brings temporary protective orders to me is the user using photographs that were taken, intimate photographs, and either threatening to publish them on social media or actually doing it as a means of retaliation.
Right. Mm-hmm. And one of the things that we see often in the shelter, how everybody wants to FaceTime or post their location or things on social media. We have to really put a stop to that quick, because with the cyber problems that we're having, you can do so much with social media, find your location. So we have to talk to the clients about that, maybe cutting your location services off. You can't post pictures, or you can't check in here. So those are some of the things that we are dealing with.
That's big.
Yes.
It's amazing what you get from just a picture.
Right, exactly. Mm-hmm.
Katora, when you talk about the abusers, do you get involved with the legal side of it? Do you report them if you learn who they are and so forth? You talk about your role in law enforcement. How does that work as far as the abusers are concerned?
They are not required to make a police report or have any police involvement to receive our services. We talk about safety. We safety plan with them. We do have a legal advocate, a couple of legal advocates that work with the victims and through the TPO, if they're able to temporary protective order, or going through the court process. As Judge Mentor said, I'm sure you see a lot of this, but they are not required. But we encourage them and we let them know, we try to support them if they want to file a police report or anything. We try to support them and empower them, but we try to give them support throughout the process.
And I believe we just started domestic court.
Oh, it's actually been going a while,
Mhm.
a few years now. Judge Morris presides over domestic violence.
You guys work with the domestic violence?
Yes, we do. Mm-hmm.
As of right now, do you have any needs? Are there any physical needs that you have? Toiletries, anything like that? If we were to donate, what's something that we
All right.
could use?
We have several volunteer opportunities, and one of the things that we've been really pushing as far as our volunteers is virtual volunteering. And when we talk about virtual volunteering, we're talking about say the Rotary group. If you all wanted to collect toilet, we usually have an item of the month each month, and we're pushed because some of the things that, like when we have these funding cuts, we're thinking of ways that we can make up for those things. And we're always needing toiletries when they come in. Sometimes they only come in with what they have in the bag that they're carrying on their side. So we provide all their necessities while they're in there. When they come in, we provide their soap, their toothpaste, deodorant, shampoos. So toiletries is a need that we always have. And we provide their towels and wash rags. And the reason we use wash rags a lot, because sometimes when they leave, they take them with them. And we're not going to say, hey, we're calling the police, so because these are items that we reach out to different groups to ask them to donate for us. So, and we consider that as virtual volunteering, and canned food drives, but toiletries and towels and blankets, because what we have are twin size beds, so gently used blankets, sheet sets, a laundry soap, because they're able to wash while they're there. The small things means a lot to us, and it means a lot to the victims that come in that, and they may come in with no socks, and we're thinking, oh, we can go buy a pair of socks. We take that for granted, but they may come in and not have that.
How would we go about getting those donated items to you?
Our main number is on there, or you have my contact number. We can agree to meet somewhere, or if you have one designated person that say, hey, I have a car full of items I would like to bring, we could work that out. You would just have to sign a confidentiality form then.
Is that something you would say if you had a need that if I like we want to do a drive right now? Tell us a need.
Yes, and like I said, which I have your email address, we have, like I said, an item of the month. I could send that to you every month, but a need that we would always need is, because we're spending lots of money on laundry soap, and the price of everything has increased. And so those are things that we really could need. We're always giving out deodorant. We're always giving out shampoos, laundry soap. We go through laundry soap a lot. And I said just the small things that we take for granted. And another thing that we also do is we put out the need for a request for gas cards. And if someone comes into the shelter, maybe a $10 Walmart gas card, if someone comes into the shelter, they're able to drive their cars in the shelter, but they may have appointments or something. And so client assistance is what we provide for them, but that $10 gas card could go a long way for a victim of domestic violence, trying to get to appointments or different things, or relocation.
I want to say something. We've had several of our mental health court participants that came into the program who not only were suffering from a mental health issue, but they were also victims of previous domestic violence. And the crisis center has been very good to assist them with temporary housing. One that I'm talking about came in destitute, completely homeless, and you guys were very good to put them up for several months until they could get their feet underneath them and get jobs and get permanent housing.
Right. And we do see a lot of victims that come into our shelter or receive our services with mental health needs. And we contract with local therapists that we're able to provide counseling for them. And we get lots of good feedback from them that it really helped them, especially during this time with the COVID, of being able to sit down and talk to a therapist about, what's going on, or, the pressure from the pandemic has just weighed me down. Plus, I have this domestic violence going on. So sometimes they come in with not only domestic violence issues, there's other issues as well.
By the time when I was in law enforcement, I would see how it's usually ladies.
Mm-hmm.
The men would isolate them, and I imagine thinking back to last March and April, where everybody was quarantining, shelter in place anyway, how that would multiply that.
Right, you're exactly right. Right, stress, more stress in the home. Right. Mm-hmm. And statistics says it takes a woman 7 times to actually make the decision that, hey, I can't go back, and our goal is, we want to treat them the same way when they first make the phone call as if they've called us 7 more times and we answer the phone and it's them. We're not going to say, oh, it's you again, you're never going to leave. Our job is not to judge them. Our job is to offer the services and say, hey, do you need shelter? So we see some of the same victims more than one time, but like I said, our job is not to judge them. Our job is to make sure that they're safe. Any other questions?
What's your average length of stay when someone comes in?
It's case by case. I've seen them come in and leave the same day, and I've seen them come in a week, but it's just case by case. And sometimes they may be there 3 months or even a little longer. And when I say case by case, because a mom with 4 or 5 children, it's not going to be easy for her to exit our shelter because she's going to have to find childcare, and there's a lot of things that she's going to have to do. And with a single lady, hey, I'm on my own, I can just go. So it's just case by case. And we've been seeing more difficult cases, meaning they may need mental health counseling, or, where we're having to put in more resources for a family.
You mentioned the multiple types of abuse, and the kind of the physical being the one that is really obvious that people can see, somebody has a black eye,
Right.
broken arm, but it sounds like maybe some of those other types, the mental, emotional, the financial, are maybe just as common, if not more so, than that like obvious physical abuse.
Yes, yeah, right. Domestic violence can happen to anyone. And, you may see someone that you think they're okay because they don't have a black eye, but they could be suffering from emotional abuse. And we actually have a lot of that, where we have when they call our hotline that they're saying they're being emotionally abused or verbal abuse, where and especially with the pandemic, they're staying there in the home, and so they're having to take more verbal abuse and they're being emotionally abused, right?
Say this, but it's harder to,
Right.
that crime has happened, that's a harder crime to prove.
But where I of course interface with crisis centers advocates most often is in temporary protective hearing. And yes, you actually do see physical abuse, but you see other things like stalking behavior, whether they're surveilling that person's house or passing by or continuously calling, texting, messaging, changing the phone number when they're blocked, just harassing in that fashion. Threats to the person and children of violence, burn your house down, those kind of things. So there's physical violence, but then there's other things that are a little harder to nail down. But yeah, we see those types of things frequently in those hearings.
Well, that's all that I have. I thank you all for inviting me. And if you would like to volunteer, the number's on the brochure. And actually, I have some more little hand sanitizers. I think hand sanitizers are always a good giveaway during this time. Right. So if you have any other questions, you can always reach out to me at our main number there. And always, if you know a victim, please give them my hotline number, and they just call us 24 hours a day, 7 days a week. Thank you.
And Katora, thank you for being with us and talking about it. And these meetings, I'd like to highlight some of the agencies that we may not think about it being affected during the pandemic, but I know you guys are very, very effective and want to communicate that out to the community as much as possible, that how much help that you guys, you're still operating, still need help, and still going. All right, we'll end it a few minutes early and end it with the Pledge of Allegiance and the four-way test.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
For the things
Say or do, is it truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned?
All right. Thank you, guys. Next meeting, March the 2nd.